Mr. Speaker, better health care is central to our agenda. To cut surgical wait times, $20 million is earmarked for cardiac care, $100 million for dialysis, and $10 million for orthopedic and eye surgery. Dental services will be revived through new equipment in 37 clinics, Mr. Speaker. Mr. Speaker, we will cut wait times for life-saving procedures because faster care saves lives, Mr. Speaker. The Minister of Health, in his presentation, will expand and provide even more details on these activities.
A few moments later.
Minister of Finance. What do you stood up?
Mr. Speaker, this will be the shortest wind-up ever of a national budget because there's nothing to respond to there. So, Mr. Speaker, on the basis of all of that, I want to thank my colleagues on this side who stood up and represented the citizens of this country while members of the PNM ducked and ran and shirked their responsibility. Mr. Speaker, it is my honor and privilege to commend this budget to the House. Mr. Speaker, I beg to move.
Hi everyone, I'm Howard of Spencer's Whole Food Plant-Based Eats and Treats, where we believe that the path to good health is by changing your environment, especially your food environment, for the better. In this series, Government Actions on Health, we take a closer look at how government decisions, especially regarding food, health, and the policies taken on these two factors affect the health of the citizens of Trinidad and Tobago. Well, at long last, the first budget statement of the new UNC administration has been read into the Parliament of Trinidad and Tobago. This budget basically lays out the government's vision for tackling the major issues affecting national life. Things like national security, agriculture, trade, economic development, education, and of course, the topic that we're dealing with today, health. It also tells us how much money is being allocated to each sector and where the government plans to get the money from. Now on this channel, since we focus on the main health issue affecting Trinidad and Tobago presently, that is the issue of chronic disease or non-communicable disease, and how our food environment influences that, the health and agriculture sectors will be the main points of focus on this channel. So, having said that, let's see how this new administration is going to carry the health of the nation forward.
We upgraded public health care by restructuring the CDAP program to include new medicines and launching CDAP Plus for specialized drugs at affordable, regulated prices. Promise made, promise kept. Our healthcare sector also benefited from the generous donations of 20 hemodialysis units and 2 C ambulances, which will significantly boost our capacity in chronic and emergency care. Mr. Speaker, between October and November 2025, a 50-day Jaipur foot artificial limb fitment camp has been established at the Wali Nagar site, benefiting 800 individuals in Trinidad and Tobago. Importantly, we signed a memorandum of understanding on the Indian pharmacopoeia for the long-term supply of affordable, quality generic drugs and treatment opportunities. Mr. Speaker, good health is the foundation of prosperity. Amendments to the Children's Life Fund Act now cover life-limiting conditions such as sickle cell disease and rare cancers, ensuring children receive timely care. Extended hours health centers now operate in 12 communities, reducing hospital congestion. The CDAP program, Mr. Speaker, the CDAP program was modernized with new life-saving medicines for hypertension, mental health, and autism, benefiting 300,000 citizens. Digitization is advancing through a national health management information system with a secure health ID, enabling seamless access to records. We will legislate a medical malpractice court, no-fault compensation fund, and a revised patients' charter. Mr. Speaker, better health care is central to our agenda. The Couva Medical and Multi-Training Facility will finally open, refocusing on children's health. This Couva Medical and Multi-Training Facility, Mr. Speaker, was renamed by those opposite. We propose to return it to its original mandate. This was designed to be the Couva Children's Hospital, a vision of the Honorable Prime Minister. We return that hospital to its original mandate, Mr. Speaker. When UNC wins, children win, Mr. Speaker. The San Fernando Hospital will add a new catheterization lab. The Port of Spain General Hospital Central Block will be operationalized by March 2026. When it's ready. And the Sangre Grande Hospital commissioned this year. This is not practical completion, Mr. Speaker. This is real completion. A $35 million refurbishment program and a $45 million in facility upgrades will modernize wards and systems. $60 million will procure critical equipment, including CT scanners, X-ray units, and surgical towers. To cut surgical wait times, $20 million is earmarked for cardiac care, $100 million for dialysis, and $10 million for orthopedic and eye surgery. Dental services will be revived through new equipment in 37 clinics, Mr. Speaker. Mr. Speaker, we will cut wait times for life-saving procedures because faster care saves lives, Mr. Speaker. The Minister of Health, in his presentation, will expand and provide even more details on these activities.
Okay, let's hear what the Minister of Health has to say. Well, for those of you who didn't get to see it, here's what happened at the end of the budget debate.
Minister of Finance. What is it up?
Mr. Speaker, Mr. Speaker, Mr. Speaker, one more time, the members of the PNM in opposition have abdicated their responsibility. They are sworn oath in this chamber. You see, while many of them spoke, Mr. Speaker, while many of them spoke and discussed all the important things, the leader of the PNM indicated that she had the authority. She had the authority to speak. And the leader herself has abdicated. Mr. Speaker, the PNM has fallen. The PNM has fallen.
Hey, we've gone very well. Okay. We've gone very well through the 14 hours or 16 hours or however long hours we've been sitting. Okay? Let's not engage at 2 o'clock in the morning into needless, useless, unhelpful, unproductive heckling. Minister of Finance.
Thank you. Mr. Speaker, they all had the opportunity to talk. They all had the opportunity to talk, and several of them chose not to. And the leader of the opposition, she vacated the chamber. She has gone. She has abdicated her responsibility again, Mr. Speaker. Mr. Speaker, and they run. And they run. The most important is, you see, Mr. Speaker, they have nothing to say because they have no choice but to acknowledge that this is an excellent budget. The opposition spoke for many hours, Mr. Speaker, and they ran out of things to say. They repeated, tedious repetition, and still had no point to make. Mr. Speaker, this will be the shortest wind-up ever of a national budget, because there's nothing to respond to there. So, Mr. Speaker, on the basis of all of that, I want to thank my colleagues on this side who stood up and represented the citizens of this country, while members of the PNM ducked and ran and shirked their responsibility. Mr. Speaker, it is my honor and privilege to commend this budget to the House. Mr. Speaker, I beg to move.
So there was no presentation by the Minister of Health, no explanation, no vision, no expansion, no account of the 8.214 billion TT dollars being allocated to the health sector. I cannot recall a time when the Minister of Health failed to contribute to the budget debate. For the past 10 years, the former Minister of Health contributed to every single budget debate. The fact that the line minister did not lay out the approved government's plan for the health sector, that speaks volumes, especially since the 8.214 billion TT dollars is the second largest allocation of the 2026 budget and is an increase from the 7.571 billion TT dollars from the year before. So, in the absence of a budget debate contribution from the health minister, along with other ministers, that's another story for another day, we have to look backwards at what Dr. Bodo said before he became Minister of Health, so we can have an understanding of what his vision is and what his philosophy is and what will guide his actions for the following years as Minister of Health. Here is what Dr. Bodo said on the campaign trail in this year's general election.
I am here tonight to tell you that when the UNC wins, healthcare will win. When the UNC wins, patients will win. When the UNC wins, doctors, nurses, and all other healthcare workers will win. Because a UNC-led government will work to ensure that all citizens receive proper healthcare. Our focus will be patient-centered and resource-driven. We will put patients first. We will deliver your services in a timely and efficient manner. No longer will the elderly go blind while waiting for their cataract surgery. No longer will heart patients die waiting for their angiograms and their stents or their bypass surgery. No longer will you have to wait years to get your CT and MRI scans. No longer will you be told that this medication and that medication is not available for you. No longer will you be waiting years for your clinic appointments and elective surgeries. We will immediately treat the backlog of patients awaiting critical diagnostic tests and surgeries, including cataract and joint replacement surgery. We will complete the construction, equipping, and operationalization of the cardiac catheterization laboratories at all of our major hospitals. Under a UNC government, you would no longer suffer from the shortage of medication that you now experience both as inpatients and outpatients. We will review and update the CDAP program to include newer and more effective drugs, especially for those persons with diabetes and hypertension. We will make every effort to ensure that cancer patients receive their treatment in a timely manner, be it their drugs or radiation treatment. The UNC government will fix the supply chain issue to prevent, you're always hearing about the shortage of drugs and equipment and supplies. We give the commitment that we will fix that. This is what hinders the work of our hardworking doctors and nurses. We will do an audit of all the faulty equipment to repair the broken equipment and to repair those that are feasible and, of course, to replace those that need to be replaced. We have to ensure, my brothers and sisters, ladies and gentlemen, that when you go to the hospitals, that the doctors and nurses are fully equipped and prepared and have all the resources to be able to treat with you and to treat with your problems in a timely manner. We will establish guaranteed maximum waiting times for clinic appointments, diagnostic tests, and surgical procedures. So you will be given the guarantee, brothers and sisters, ladies and gentlemen, that when you visit a health facility, that you will be given a time, maximum time that you'll have to wait for any of these investigations. And we will ensure that you, the taxpayer, get value for your money for the over $7 billion annual expenditure in the health sector. So instead of contracting out the disposal of medical waste to friends and financiers at a monthly cost of hundreds of thousands of dollars, we will repair and, if necessary, upgrade the in-house incineration equipment at the SWRHA. We will ensure that that money instead will be spent on fixing the electrical system at the Eric Williams Medical Sciences Complex, so you don't have to move ICU patients to another facility every time there is a power outage. What an outrageous situation. Brothers and sisters, ladies and gentlemen, we will ensure that doctors and nurses at the Arima Hospital do what they are paid to do, which is instead of having to transfer their patients to Eric Williams for emergency care and surgeries because they are not provided with the resources to do their work. We will make sure that the Couva Hospital is fully operationalized and will be there to benefit all of the citizens of Trinidad and Tobago. And talking about COVID-19, we commit to doing a full review of the management of COVID-19 pandemic in Trinidad and Tobago. And we will create an emergency response plan to cover all possible medical crises ranging from natural hazards and oil spills to infectious diseases. Our leader has the plans and policies to rebuild and restore not only the health sector, but our entire nation of Trinidad and Tobago. She is a caring and compassionate leader. Her number one item on the health manifesto is to deal with children, and it is this. It is a commitment to review the Children's Life Fund legislation so that many more of our children with urgent surgical and other medical requirements will be able to access this facility. Kamala Prasad Bisesa will ensure that the elderly and school children receive compassionate and timely care. We'll once again open your health centers for extended hours and on the weekends for your convenience. We will engage the over 500 unemployed doctors to reach out to the elderly and school children in a real and meaningful way in their homes and in the schools. The UNC will ensure that our newborn babies are looked after properly. We will review the status of all the NICU units in our health facilities. You will no longer have to worry that when your newborn baby might die from an infection because there is not enough hand sanitizer available for doctors and nurses to wash their hands.
And here are some of his contributions as a member of the opposition during previous budget and other debates.
There are two aspects to this to the health sector, and I want to say at the very outset, both as a medical doctor and as a member of parliament, that I do agree that the approach of health and wellness is important for our country. We on this side agree with the approach of primary health care, and we understand that there are many of these policies that will benefit Trinidad and Tobago, will benefit the health of our people. We know a healthy nation is a productive nation. And, we will be willing to, to support many of these measures, many of which were already started during our time in government between 2010 to 2015, and I'll come back to talk a bit more about that. But also, Mr. Deputy Speaker, I want to make it very clear at the beginning that, whilst all of these measures are important, and while primary care is important, at the same time, it's very important to recognize that while we are taking a preventive approach, and all of these measures that are outlined, at the same time, there remains the issue of secondary care, the issue of treating with the problems that we see. And I welcome you, Madam Speaker, the issue of treating with the problems that we currently face and that citizens of Trinidad and Tobago currently face in the health sector. And many of these problems, in fact, are related to the complications of diabetes and hypertension. And I have a few suggestions I would want to make to the Minister of Health in my contribution, and I hope that he would be kind enough to give them consideration. But I just want to say, again, if we look at the figures, the question really has to be asked that over the last 8 years, with the approximately $50 billion that has been spent in the health sector, whether the citizens of Trinidad and Tobago are getting value for money. This is something that has to be asked, Madam Speaker. It's a budget debate, and we always have to look for value for money when we discuss taxpayers' expenditure. And the question really is whether that is we're getting value for money. And many will say that the answer is no. Madam Speaker, the other issue here would be, of that approximately 50 billion, about 35 billion has been allocated to the RHEs. And again, the question is being asked, is the public health sector better off than it was 8 years ago? The Minister of Health, member for St. Joseph, would have, painted a very rosy picture, but it's really a picture, it's a futuristic picture of where we are aiming to go. but he has made no real effort to address some of the current problems that we are facing. At a recent PAC meeting that I alluded to earlier in my contribution, Madam Speaker, the NEPDEC officials indicated that some 186,000 patients are registered for CDAP, with some 49 drugs in the formulary. The Minister indicated that we had something against CDAP. Madam Speaker, I want to give the population the assurance that we on the side have absolutely nothing against the CDAP program, Madam Speaker. In fact, we believe, I want to make it clear, we believe that it is an important mechanism in the fight against our biggest enemy in this country, after the crime that is, Madam Speaker, and that is our NCD burden. We believe that, and we agree with that. All we want to do, Madam Speaker, with regards to CDAP is we want to ensure that the most efficacious drugs are available to patients as determined by the medical experts, Madam Speaker, and not the politicians. So, Madam Speaker, we will ensure that CDAP remains available to those citizens who need it and with the most appropriate drugs for their conditions, Madam Speaker.
So from these clips, we can get a fair idea of how Dr. Bodo views the local health sector. And to be fair, some of his past comments on the health sector do show concern for valid, long-standing issues such as efficiency, hospital infrastructure, staff shortages, shortages of equipment, among other things. However, this marks a somewhat significant shift in the vision and philosophy of healthcare in Trinidad and Tobago compared to the previous administration. Because while the former government also faced its share of criticism, including from yours truly, its messaging on health, at least early on, was framed around prevention, wellness, and personal responsibility as part of the National Health Strategy. Here's the former Minister of Health, Mr. Tr&T, outlining his vision for healthcare during a Caribbean Wellness Day event in 2017 at a major regional workshop hosted here in Trinidad and Tobago.
I have a habit of putting my foot in my mouth, and today is going to be absolutely no exception. Because wherever there's an inconvenient truth to be told, you must not back away from it. 2, since assuming the role of minister, I have never, ever been introduced correctly. My name is correct, Terence Dial Singh, the honorable, temporarily I will hold that. I am a minister, I am from Trinidad, but I am not the Minister of Health. Because what I have found is that I am the Minister of Healthcare. Trinidad and Tobago has spent $40 billion in healthcare from 2005 to 2016. But are we healthier? The answer is no, and that's where I put my foot in my mouth. I am the Minister of Healthcare. I am the Minister of providing scalpels to amputate legs. I am the Minister of providing anti-diabetic drugs, health care. I am the Minister of providing statins, free health care. I am the Minister of providing methyl-dopa, health care. I am the Minister of providing anti-cancer drugs to combat lung cancer due to lifestyle diseases, health care. That is what I am. I am not the Minister of Health. So in spending $40 billion from 2005 to 2016, and we have Professor Carl Theodore here, Professor in Health Economics, who could tell you that all of that money has been wasted. Because we amputate more legs today than we did 20 years ago. But we have this impression that we must provide health care to the population. The population demands health care. I heard on the radio yesterday somebody advocating that the government of Trinidad and Tobago should now provide stem cell treatment. Government can't provide all these things for free. We have to decide what model of health care we want for our society. If I'm to be the Minister of Health, we have to have an intervention with children in the schools. And we have started that conversation with the soft drink manufacturers to come to us with voluntary cuts in sugar limits to drinks sold in schools. Because if I'm the Minister of Health for the obese diabetic child today, I don't have to be the Minister of Health Care for that same child 20 years from now when they present our hospital to chop off their legs because they have uncontrolled diabetes. You see the difference I'm trying to make from moving from being Minister of Health Care to Minister of Health. But the intervention that is needed is greater than our collective abilities so far. Because in Trinidad and Tobago, at least, we have made absolutely little or no progress in controlling the epidemic of diabetes, hypertension, high cholesterol. Those are the 3 highs we need to bring to 3 lows. So what is the plan? The plan is, as Minister of Health, we need an intervention to break the cycle of societal factors and genetic factors that lead Trinidad and Tobago to be a leader where we should not be a leader. Unless we get our 2 main groupings in Trinidad to understand that whilst you can't control your genetics, you can control your surroundings, and you could control this deadly relationship you have between your hand and your mouth. That is, you could control what your hand picks up from your plate and shovels into your mouth. That, my friends, is what you have control over. But what I can change is what I eat, how I exercise, and how I live my life.
As you can tell in that speech, he emphasized that Trinidad and Tobago's fight against chronic disease couldn't rely on hospitals and pharmaceuticals alone because it was getting way too expensive. He determined that the health of Trinidad and Tobago, if it was to take a turn for the better, it was going to depend on Trinidad and Tobago's approach to prevention, education, and living a healthy lifestyle. And to be fair, under his tenure, we saw quite a few initiatives roll out under that prevention, health, and wellness banner. Number 1, you had the National Strategic Plan for the Prevention and Control of NCDs 2017 to 2021. This document was a very comprehensive document which outlined the status of the chronic disease epidemic in Trinidad and Tobago and what targets were to be achieved within a certain time period and what were the action items that were to be taken in order to reach those intended targets. One of the things that was very clear in that document, or one of the major takeaways from that document, was that to achieve a substantial reduction in the incidence and mortality from NCDs, it required a multi-sectoral approach. Another initiative launched under Mr. Dayal Singh's tenure was the TT Moves campaign. This was a national lifestyle campaign promoting physical activity and healthy eating. This included community fun runs, school challenges, and corporate wellness events across the country for many years. Yet another venture launched under Mr. Dayal Singh's tenure was the Diabetes Wellness Clinics and the Hearts Program. Here is Mr. Dayal Singh talking about the success of the Diabetes Wellness Clinics and the Hearts Program.
Goal 4 of Vision 2030. Citizens will be empowered to lead healthy lifestyles. We started last year in 2023 for the first time 2 interventions in diabetes and hypertension management. And when I spoke in the budget, I said I will come back with the closeout figures for 2023. I did not have them at the time. I now have them. And I want to tell the country via your good office, Madam Speaker, what we are doing with diabetes. We are taking 811 of our severe diabetics, uncontrolled, with HbA1cs 10, 14. Cutoff is 8. Once you are 8 and above, we pull you into these diabetes boot camps, for want of a better word. And you get out of it after 6 months, getting 2 consecutive HbA1cs of 8 and under. I now have the closeout figures for 2023, and I am so grateful for this opportunity. And one is in the constituency of Princestown. I was there. You know what is happening now? We are now discharging patients with HbA1cs from 10, 11, 12, 13, 14, who were candidates for lower limb amputations, and they are now being discharged at 6.9. 811 patients, the worst diabetics in the country. That is what we are doing. It's a success story. My God, let's celebrate it. Madam Speaker, the next big NCD is hypertension. Strokes, cardiovascular accidents, we know the stories. This was a new intervention which we launched prior to COVID, but which again, I now have the 2023 closeout data. For the first time in this country's history, we are collecting data because we are digitizing and we are digitalizing. And this is what the member was speaking about, records. And yes, on the issue of patient records, we are in the process of digitizing and digitalizing those records. So hopefully we can, and that, I have always admitted that that is a historical ill, hopefully will come to an end soon. But the 2023 closeout figure, data for our hypertension intervention goes like this. It's a project called HEARTS, Madam Speaker, under PAHO, and I want to thank PAHO. We have enrolled 62,207 patients. We have a cutoff of 140 over 90, where we consider you control, the doctors will agree with that. In June 2023, when I had the 6-month data, which I reported in the Parliament in my budget presentation, 37% were controlled. We closed out December 2023 with 29,632 or 48% control. I think that is a success story. I think that will put Trinidad and Tobago on the map. I think that is something to be celebrated. Because it means people are getting interventional care for both diabetes and hypertension before it reaches a crisis.
Now, all of these reflected a coherent philosophy that if we want to reduce the burden on our hospitals and our health clinics, we're going to have to start with prevention and controlling the risk factors before they become life-threatening situations. So when we contrast that with what we've heard, or rather not heard, from the current administration's first budget statement, it seems that we are shifting away from a prevention mindset towards a treatment-heavy mindset. In other words, the prevention model that was used to guide the last administration seems to be replaced by one that waits until people get sick and then spend billions and billions of dollars trying to treat them and hope that they recover. When one looks at the current administration's health allocation of 8.214 billion TT dollars, one can easily assume that the government is making health a priority. However, if you take a deeper dive into what the money is being used for, it is being used to maintain and uphold a system that treats people after they get sick.
A $35 million refurbishment program and a $45 million in facility upgrades will modernize wards and systems. $60 million will procure critical equipment, including CT scanners, X-ray units, and surgical towers. To cut surgical wait times, $20 million is earmarked for cardiac care, $100 million for dialysis, and $10 million for orthopedic and eye surgery.
Instead of, actually trying to prevent it in the first place, the budget highlights expansion of the CDAP program, procurement of new medical equipment, construction and refurbishment of health facilities, and hiring of additional medical personnel.
All right, you have 165 million for vacant posts. How many posts would that fill?
It's something we are looking at this point in time. The information we have is that there are 71 thereabouts house officer positions in the RHAs, various RHAs, and several vacancies for nurses as well. So it is a cater mainly for, as you know, remember we would have had so many unemployed doctors looking for house officer positions. So the attempt here is to try and employ some of those doctors as well as fill some of the vacancies for nurses.
Okay. How many nurses are you planning to employ?
Yeah. At this point in time, we're still in the process of trying to establish the number of vacancies, but I'm informed that this could actually employ in the region of about maybe 400 or 500 nurses.
500 nurses for 165 million, I see. And that also includes doctors.
Yes, we're attempting to fill some of the positions for doctors.
All right, and you're telling me you're not sure how many vacancies there are for doctors or nurses?
Well, we are certain about the doctors' vacancies. There's 71
house officers?
house officer positions.
What about the other categories of doctor? Specialists, registrar?
Yeah, those are normally paid for from the allocation to the RHAs, remember?
I see. So you have 71 house officers and somewhere between 400 and 500 nurses that you're going to fill with this allocation. That's your plan?
Yes, that's it. That's the plan.
All right.
Now, don't get me wrong. All of these are important, but they're also reactive. What they deal with symptoms of the problem. They don't address why many citizens of Trinidad and Tobago end up challenged with chronic disease or non-communicable diseases in the first place. For example, even the increased funding for CDAP, which some have described as a testament to the failing healthcare system, is a reflection of that problem. We keep expanding access to drugs, or we try to procure more powerful or better drugs for diseases such as diabetes, hypertension, kidney disease, and so on, yet not addressing why we develop these diseases in the first place. Doesn't that sound familiar? Here is the problem which I have with the HEARTS program in its present form. Even though the HEARTS program was launched in Trinidad and Tobago in 2019, and it has expanded to over 100 centers around the country, hypertension rates still increased from 26% in 2012 to 29% in 2024. So that means the HEARTS program alone is not doing the job. Think of hypertension like this. You have an overflowing sink with the tap running water at full throttle. What do you think that needs to be done in order to remedy that situation? You turn off the tap. It makes no sense getting a mop and a bucket and cleaning up the mess off the floor if there is more water coming from where it came from, the overflowing sink with the tap running at full throttle. But yet, this is exactly what you're doing with the HEARTS program. Mopping up the floor, but there's more where that came from. Now, that being said, in fairness to Dr. Bordeaux, in the Standing Finance Committee, he committed to keeping the inherited wellness programs from the last administration.
Is the Keep Moving campaign that was previously launched by the Ministry of Health one of those programs to encourage the country to continue to remain healthy?
So remember, NCDs remain a critical challenge for Trinidad and Tobago, and part of the ministry's mandate remains the treatment of NCDs and, of course, the prevention of NCDs. Wellness programs remain part of the remit of the ministry. Remember.
Noted. Thank you.
Now, I want you to note in that clip, he said treatment first and prevention afterwards. So that could be a possible glimpse as to what his priorities are. So it remains to be seen whether these inherited wellness programs will thrive under this administration or they will die a slow, quiet death, basically out of neglect. And the priorities of the administration will determine where the focus is and in turn where the money ends up. Now, when we're talking prevention, we're not talking about simply encouraging people to eat better and move more. Anybody who has been in the thick of trying to change people's behavior knows that it requires much more than encouragement to do so, especially when it comes to food and especially when it comes to lifestyle habits. Most people will know that if you place a recovering alcoholic in the middle of smoky and bounty, all of the encouragement in the world is not going to work. What you need to do in the case of the recovering alcoholic is that you need to place the recovering alcoholic in an environment in which the temptation to succumb to alcohol is not there. And that, in a nutshell, has been one of my main criticisms of the last administration. The last administration put most of its emphasis on encouraging the population to eat better and move more. But what they were very reluctant to do was that they were very reluctant to actually put measures and policies in place so that the population can be placed in an environment in which eating healthier and moving more will be easier to do. But there have been many instances where they were very reluctant to do that, or plain flat out said that they were not going to do it.
On the heels of the health minister's public condemnation of fast food restaurants and soft drink producers comes a call from the Diabetes Association for taxes to be implemented. In a statement, the DATT says, drawing on strategies discussed at the Healthy Caribbean Coalition in July 2023, it is advocating for a comprehensive approach to removing ultra-processed products from schools and communities. Among the three recommendations are taxes on sugar-sweetened beverages and ultra-processed foods, as well as bans on targeted advertising. However, the idea has been shut down by Health Minister Tr&T, who tells CNC3 News that no taxes in this regard are being considered.
So that's why we're asking the question from the committee's end, if you have any planned legislation, just like vaping, in terms of packaging and unhealthy foods?
No, at this point in time, and I made that point clear when I spoke at the Assembly, we have no plans to legislate what people eat. We ask people to make the wise decisions.
Now, from a government viewpoint, how do you create that environment so that the people who are under your purview can make healthier choices? What you do is that you put policy measures in place so that the healthier choices are the easier choices, they are the clearer choices, and they are the most affordable choices for everyone from top come down. Do you know that this is not a novel idea? As a matter of fact, in 2007, right here in Trinidad and Tobago, in Crown Plaza Hotel to be exact, the then CARICOM heads of government met in what turned out to be a historic summit on non-communicable diseases, highlighting the ways that non-communicable diseases were affecting the population of the Caribbean nations and the solutions that came out of it that were pledged to be implemented within the various Caribbean territories in what turned out to be the Port of Spain Declaration, uniting to stop the epidemic of non-communicable diseases. Now, obviously, Trinidad and Tobago was one of the signatories of that declaration. And one of the declarations that was made was the introduction of food labeling to highlight the various nutrients of concern on packages being sold to the Caribbean population. 10 years later, that same declaration from the Port of Spain Declaration reappeared in Trinidad and Tobago's National Strategic Plan for the Prevention and Control of NCDs 2017 to 2021. Now, that document listed the Ministry of Trade and Industry as the ministry responsible for introducing and monitoring the food and nutrition labeling in Trinidad and Tobago so that the citizens of Trinidad and Tobago can make healthier choices when it comes to their food. What that shows is that the prevention and control of NCDs is not just a matter for the Ministry of Health alone, but it is a matter that involves the whole of government and the whole of society. In other words, every single ministry has a part to play in the prevention and control of non-communicable diseases. Yet, despite these declarations and despite these commitments, dating back to the 2007 Port of Spain Declaration, and despite all of the evidence and data that shows that food and nutrition labeling, especially in the front of package, it works, these measures have never been implemented in Trinidad and Tobago. This call for front of package labeling to help the population to make healthier choices has been advocated by many health-focused organizations, most notably the Diabetes Association of Trinidad and Tobago.
In terms of the Diabetes Association, Dr. Danu, what is your organization's take on supporting more stringent government policy interventions? For example, restricting on the promotion or advertising on certain items which may be unhealthy for persons to consume, etc. What's your position on that?
Yeah. So there are a suite of interventions that can be done which have been proven to increase the health of a population. These include taxation, these include limiting marketing, these include front of package labeling. The two that I think that are going to work best in Trinidad is front of package labeling and marketing, limiting marketing. The other is front of package labeling. I know Asante is a supporter, and I know Amit and they are supporters of front of package labeling as well, because we want simple front of package labeling, a black octagon on the front of a package that says high in sugar, high in salt, high in fat, to give a person the ability to make an informed decision when they pick up a product. Because so many people aren't able to read the label. They may not have the time to read the label, may not understand the back of the label. So we want that black octagon in the front of all the packages saying, this product may be high in sugar, salt, trans fat. It's up to you if you want to consume it. So we need that.
However, when asked the question whether front of package warning labeling was on the cards or in the works for his administration, this is what the former Minister of Health had to say.
Additionally, Minister, as we look at legislation again, are there any plans as it relates to front of package labels, taxation on unhealthy foods, restriction on advertising, etc.?
On the issue of front of label packaging, that is a trade matter which the Honorable Paula Gopi School is leading at the CARICOM level. So the Ministry of Health works with the Ministry of Trade on that.
But Minister, we are not speaking ban, but legislation can somehow regulate. So that's why I'm asking about legislation, not specifically banning anything.
What legislative measures would you recommend?
It will depend on your findings.
Yeah.
So that's why we're asking the question from the committee's end. If you have any planned legislation, just like vaping, in terms of packaging and unhealthy foods.
No, at this point in time, and I made that point clear when I spoke at the Assembly, we have no plans to legislate what people eat. We ask people to make the wise decisions.
Well, speaking of CARICOM, here's what happened to front of package warning labeling at the CARICOM level.
So this is our second time around the block. We had a vote in 2021 where 6 of 15 member states supported the octagonal warning label. Antigua and Barbados, the Bahamas, Dominica, St. Lucia, and Suriname. 3 opposed, Grenada, Guyana, and Jamaica. And the remaining 6 countries of the 15 CARICOM member states abstained. Abstentions arise out of a variety of reasons. When there's lack of consensus, or the member state does not feel that they've had an opportunity to have a truly consultative process. Abstentions do not count in the denominator. So in 2021, 6 of 9, or 66%, was insufficient to meet the 75% threshold, which is needed to advance the final draft to the next stage, where it goes back to cross-queue, then it goes off to COTED, and then you have a regional standard. So the standard was then relegated back to a draft standard and sent out yet again for further regional consultations, which took place over 2022 and 2023. Ultimately, in March this year, 75% of CARICOM Regional Technical Subcommittee, there are 12 countries which are tasked with the national consultation. Greater than 75% of those countries accepted the draft standard, which contained the OWL, or octagonal warning label, which triggered elevation yet again to the final draft standard and advancing to the regional vote, which is currently underway. In 2023, we had another vote, and the vote failed again with a lower positivity rate. And decision was taken at this point to remove the octagonal warning label and the power-nutrient profile from the standard altogether. And the standard was then approved without the warning label in October 2024 by the COTED.
In 2021, Trinidad and Tobago was one of the CARICOM member states that abstained. The votes of the individual CARICOM member states was not revealed in the 2024 vote. However, it can be assumed that Trinidad and Tobago either voted against the front of package warning labeling measure or abstained, because there was no public health campaign from the Ministry of Health advocating for such a measure. I guess developing policies for food and nutrition labeling was a tad bit too much for Paulo Gopi-Spoon and company. And I find it to be a huge oversight and an overall travesty that Paulo Gopi-Spoon and company were not heavily questioned about the reluctance of such a measure. Now, in this seminar here, I asked Ms. Maisha Hutton if an individual CARICOM member state can implement its own front of package warning labeling legislation outside of the CARICOM realm, to which Ms. Hutton answered in the affirmative. However, she also noted that most of the time, CARICOM member states we usually like to operate in lockstep with the rest of the CARICOM member states. But it seems that this current UNC administration seems very comfortable operating outside of the CARICOM realm, especially given certain developments.
Do you think that you have full support from your regional heads in what's happening? Go ahead.
It is clear. I'll be burying my head in the sand if I were to say yes. It is very clear that some of our CARICOM partners have taken a different view by talking about the zone of peace. But there is no zone of peace in Trinidad and Tobago. Maybe there's a zone of peace in some of those other CARICOM neighbors because they are further north. We are the closest here to the mainland. And of course, we are being hit, I think, really seriously hit with the drug trafficking, the gangs, the cartels, the human trafficking, the gun running. That is not happening in their country because they are not having 600 murders in a year. You know. The level of their crime is not what is happening in Trinidad and Tobago. So they are saying it's a zone of peace, keep a zone of peace. But Trinidad and Tobago is definitely not a zone of peace. We have witnessed too many murders, too much crime, and too much drug running, human trafficking, gun running to Trinidad and Tobago. So CARICOM is proving to be an unreliable partner in some regards because they chose Venezuela over Trinidad. They chose Venezuela over Trinidad. And that is something we need to remember.
But I digress. So it remains to be seen whether that same mindset will apply when it comes to front of package warning labeling. I note that because front of package warning labeling was a campaign promise of this administration. In its election manifesto, this administration pledged to introduce warning labels on foods which are high in sugar, salt, and fat, especially to combat childhood obesity. This was reiterated by Minister in the Ministry of Health, Dr. Richard Ticharan.
Among several of the initiatives that we propose in the next fiscal year, we propose, as Dr. CARICOM said, legislation for front of package warning labeling to highlight foods that are high in sugar, sodium, and fats based on PAHOL's nutrient profile model.
But when the 2026 budget was read, Not a single reference about front of package warning labeling. Not in the budget statement, nor in the Standing Finance Committee stage. And the silence on this is deafening because policy measures like front of package warning labeling are one of the most cost-effective NCD prevention tools that they are available. Because what this does is that it reduces the marketing power of the manufacturers of these unhealthy foods. They help people to make informed decisions. And if anybody has been paying attention to Chile and Mexico, front of package warning labeling has been helping consumers to make more informed purchases about their foods and actually shifting purchasing behavior.
The results we have from other countries that have implemented that are very robust in demonstrating that consumers have changed their purchase decision to a better decision. Even at the very first days of the implementation, for instance, in Uruguay, more than 58% of the consumers already have changed their purchase to a better one. We have objective data from sales in Chile showing that products that carry warnings, they have a reduced number of sales. Projections from Mexico showing that the reduction in prevalence of obesity and also the save in costs with obesity prevention due to that. And also a huge impact on the induction of reduction of ingredients of critical concern in products. These products, just as sold in the USA right now, if we were to apply octagonal warning labels, they will have these 4 octagonal warning labels. But the product that they export to Mexico, given the requirements there, have been changed in ways to reduce the amount of total fats and the amount of trans fats as well.
And the other thing I want to show you is that in Mexico, in the first 2 phases of implementation of the warning labels, we have seen a lot of approval, comprehension, and use of the warning labels. So in population behavior, very good responses. Also, we have seen interesting effects on diet and health. We have seen change in purchases of ultra-processed foods, lower amount of calories consumed from soda, and more consumption of plain water, and less calories consumed.
So when the government omits this measure, a measure that has the potential to be of benefit to the population, especially when promising it in the election campaign, yet omitting it from the budget statement, it raises a serious question. Are we abandoning the prevention agenda from the previous administration to one in which illness is merely managed? Because if we as a nation cannot follow up on basic health promoting measures advocated for by health organizations in Trinidad and Tobago, such as the Diabetes Association of Trinidad and Tobago, among others, if we as a nation cannot follow up on that, the message that is sent is that the fight against NCDs, it's not about trying to prevent NCDs from taking hold, but minimizing damage once the NCD occurs. Now, when these prevention measures are usually put forth into the domain, one of the main arguments in implementing these prevention measures is the cost involved. And it's an ironic argument because if the prevention measures such as front of package warning labeling, salt and trans fat consumption studies, among others, if they are not implemented because it's too expensive, we end up actually spending more in the long run. Because guess what? Every diabetic foot amputation, every dialysis treatment, every bypass surgery, among other procedures, all of that adds up to billions in healthcare that could have been reduced or in some cases prevented entirely. And that is the part that hardly makes it into budget speeches. The economic cost of treating what could have been prevented. Remember what Mr. Diyal Singh had to say?
Trinidad and Tobago has spent $40 billion in healthcare from 2005 to 2016. But are we healthier? The answer is no, and that's where I put my foot in my mouth. So in spending $40 billion from 2005 to 2016, and we have Professor Carl Theodore here, Professor in Health Economics, who could tell you that all of that money has been wasted. Because we amputate more legs today than we did 20 years ago.
In short, penny wise, pound foolish. And it's not just me saying this. Many prominent voices in Trinidad and Tobago have voiced concern about the exponentially rising cost of healthcare in Trinidad and Tobago.
I'd just like to make a general point. You will realize we are supplementing the Ministry of Health by almost $500 million, almost $500 million. Now, the Ministry of Health already requires a significant sum of money every year, another $5 billion or so. It is proving quite difficult to finance the purchase of free pharmaceuticals and all the other free services that are available in the health sector. So I just want members to understand this. We believe this is important, we have to do it, but to find that $500 million is going to prove to be very difficult. If one actually looks at how much is being spent on the health sector over the years, it has been increasing exponentially. I recall when I was Minister of Health, which is some 20 odd years ago, the budget was $1 billion. So in that 20 years, it's increased from $1 billion to over $5 billion. So understand, we as a country spend huge amounts of money on healthcare, and it is something that we need to look at to make sure that we are getting value for money and so on.
Madam Speaker, NCDs is one of the most critical elements facing this country. And our health budget went up from $3.08 billion in 2008 to $6.0 billion in 2019. That is unsustainable. We have to tackle NCDs.
But we recognize that really and truly the children are our future as it relates to NCDs and getting a society that is healthy. Hence the reason we have put significant investments in the exercise equipment. But if we put exercise equipment in there and it's not used, it doesn't make sense. So we, as a major partner, the Ministry of Education has been working with us. And really to get exercise is not about schools alone, not about exercise equipment. We have to get the parents involved. We have to get the PTA involved. We have to get the extended families involved. And that's why we said we need all of government, all of society to deal with this issue. Because we can't hold your hand when you're at home. We can't tell you what to eat at night. Your parents have a big interest. We can't tell you what to buy at the grocery stores, aside from putting legislation in place to deal with certain aspects of it. So it requires all of us. And the children are really where I think the future is at, as it relates to getting our country to a place where we are a healthier society on the whole. So our target will certainly be at the children going forward over the next few years. And it's not a short lead project. We're talking about decades. To see a healthy population, we're talking about 10, 20 years into the future. So we're trying to put the seeds in place now so that in 10 years, we don't have the cluttering of the A&Es. Because what we're seeing now is a symptom of the NCD epidemic, which has started 20 years ago. If we don't stop the epidemic, and our greatest weapon to stop the epidemic is primary prevention, if we don't stop it now, in 20 years, I guarantee, even with a new 500-bed tower in Port of Spain, a new ARIMA, a new Sandy Granny Hospital, we will not have enough bed space.
One of the things that I've learned in these interfaces and in looking at the data, not only in Trinidad and Tobago, but around the world, is that a country cannot spend its way out of this. You could put $10 billion, $15 billion, $20 billion. If the population doesn't get the message about prevention and taking decisions in your life and your family's life to make sure that you are healthy as possible. And if you will get sick, you go and get an early detection and management of it. The country will have to spend more and more and more, and it's more and more heartache for you and your families.
And the sad part is that they are not exaggerated. When effective prevention policies are not realized, the downstream effects don't just show in hospital budgets. It shows up in productivity loss, absenteeism, lower national output, all of which in turn leads to lower national economic output and in turn puts a strain on the finances or the purse of the country that is dealing with such a health crisis like Trinidad and Tobago. So when a government overlooks prevention measures, either knowingly or unknowingly, what it does is that it presents a human and a fiscal risk that grows larger with each passing year. And in a small economy like ours, where we have a relatively small population and a relatively small economy, and we do not produce pharmaceuticals on a large scale, prevention isn't an option, it's a necessity. Yet the 2026 budget did not highlight any such prevention measure. In other words, from the health sector perspective, what this government seems to be doing is what the last administration was doing with the HEARTS program. Mopping up the floor, but there's more where that came from. So when Dr. Bodo says this,
But when the UNC wins, healthcare will win.
from the NCD burden perspective, this budget doesn't give much reason to be optimistic. And here's another reason why I'm not so optimistic.
Today I am proud to say that this Canada Prasad Bisasa-led administration will again be removing value-added tax from a multiplicity of basic food items. These items include table salt, Morbi, coconut water, as well as locally produced pumpkin, watermelon, cucumber, lettuce, and tomatoes, amongst others. This is a government that cares about the average citizen, Mr. Speaker. You see, when the UNC wins, everybody wins. This effect will take effect. This measure will take effect from October 17, 2025.
Table salt, VAT-free. Does he know that the prevalence of hypertension is at 29% in Trinidad and Tobago, according to the latest STEP survey? Well, chalk up another win for healthcare.
When UNC wins, everybody wins. When UNC wins, Trinidad wins. Trinidad wins.
That I will discuss in my next video. If you want to be notified of it first, hit the subscribe button. And if you got value out of this video, be sure to click the like button and share it amongst your friends, your colleagues, and acquaintances. Help to get the message out of improving your food environment in order to improve your health. If you made it this far, thank you for watching, and I'll see you soon.